Birth control is a good medicine for young teens to take to prevent early childhood pregnancy. On Planned Parenthood, it says the birth control pill is a safe, simple, and convenient way to prevent pregnancy. If the instructions for a birth control are followed, it will prevent pregnancies. These rules include taking the pill every day and taking it at the same time every day. If these rules aren't followed, the pill won't work. There are also two different types of pills that can be taken: combination pills and proestrogen only pills. The combination pill has to just be taken every day, but the proestrogen pill has to be taken within the same time, within 3 hours every day. If a day is missed, the pill won't work as effectively. A condom can be used while taking birth control. This would add extra protection against pregnancy. A condom would also protect from STDs, which birth control doesn't protect people from that. Pregnancy is the only thing birth control protects people from. The pill does have some other benefits. The pill can help with acne, bone thinning, cysts in your breasts and ovaries, endometriosis, and ovarian cancer, serious infections in your ovaries, fallopian tubes and uterus, iron deficiency, PMS. The pill also helps with regulating your cycle, make your period lighter, and helps lessen the cramps during your period. The pill allows you to still get pregnant when you stop taking it. It doesn't cause any effects for getting pregnant after taking the pill. A birth control pill is a great and safe way for young teens to prevent pregnancy during sex. The history of birth control has changed a lot throughout the years. Birth control has lowered the percent of teen pregnancies throughout the years. Women'sHealth.gov says, in 2013, the CDC reported that birth rates for U.S. teens 15 to 19 years old dropped to a record low not since 1946, which shows that birth control has been taking effect on stopping early teen pregnancy. Birth control wasn't even out in the year 1946. Birth control first came out in 1950, which was only 4 years after 1946, but the pill didn't come widely available to 1960s. Although the earliest forms of birth control were founded in ancient Egypt and Mesopotamia, back as far as 1850 BC. This form of birth control wasn't widely known. The form of birth control was made from plants. It was also very toxic and very dangerous. Women in ancient Greece were advised to drink copper salt dissolved in water with copper salt, which copper salt is highly toxic. Another form of birth control during this time was the pull-out method. If this method is used correctly and consistently today, it has an effect rate of 78%. In 1916, a woman named Margaret Sanger opened the first birth control clinic. 9 days after opening it, it was shut down by the Comstock Act and its associated laws. This started a movement for birth control. Margaret Sanger, other prominent feminists, and doctors helped to promote birth control and the idea of separating sex from procreation. This made the U.S. attitude from 1920s to 1950s change dramatically about birth control. This started to raise a lot of questions. Some of the questions included personal freedom, liberal and conservative values, government interventions, religion and politics, and ideas regulating sexual morality and social welfare. The first pill was created in the 1950s. Pandia Wealth says the pill and also widespread access to many methods of safe and effective birth control has completely revolutionized women's life. When women can plan to have children and how to have women, and also society experiences an untold number of benefits from the pill. The history of the birth control pill has changed a lot throughout the centuries. Birth control is a really good way to prevent pregnancy for teens during sex. Women'sHealth.gov said there are two different types of birth control methods: barrier methods, short-acting hormonal methods, and long-acting reversible contraceptives. The short-acting hormonal method, including the pill, mini pill, shot, and vaginal ring, These prevent your ovaries from releasing eggs or prevent sperm from getting to the egg. The barrier method includes condoms, diaphragms, sponges, and cervical cap. This method prevents sperm from getting to the egg. Planned Parenthood said the long-acting reservable contraceptives include copper Paragard IUD, the hormonal proestrogen Minera IUD, and the hormonal contraceptive implant. These are the most effective methods of birth control. These methods can prevent unwanted pregnancy up to 20 times better than birth control pills, patches, and vaginal rings. Birth control comes in different sizes. There are not one size fits all. If a woman would want to get pregnant, IUDs and implants would be a great method because they are reversible. The term reversible means that at any time a woman decides she wants to get pregnant, they can be removed. These two methods cannot be personally removed. They have to be removed by a healthcare provider. A safe and high effectively method for women who have been pregnant or IUDs. There are multiple different types of birth control methods to choose from. Birth control plans for teens are great, says Caring for Kids. Getting teens to talk about sex and their body changing can be very difficult. This is a very important topic to talk about. It's also a good idea to have this talk, but not the talk. A lot of teens have multiple unanswered questions about sex and birth control. This discussion is good to have early in a teen's life, before they decide to have sex. Although this topic in a conversation can be totally overwhelming, it's something that should be talked about more often. There are questions a parent should ask their children, like, are they a boy or a girl? What they know about preventing pregnancy, and what they know about protecting themselves from STDs or STIs. Being open with your kids shows that if they ever have any questions about anything, they can come to you. Parents should encourage their kids to talk to their healthcare providers about birth control. When talking to a healthcare provider, everything that is said is 100% confidential. Also, when talking, a parent doesn't have to be in the room at the same time the discussion is going on. No matter what method the teen would choose, a condom should always be used during sex. Caring for Kids said, condoms are the only birth control method that protects against HIV and other STIs, including STDs. Safe sex is always the best way to go. Also, in the conversation, teens are told that using 2 condoms at one time doesn't add extra protection. Using more than one condom at a time could end up in condoms breaking or a condom ending up getting stuck in the cervix. Extra protection means using a condom and some method of birth control at the same time. Talks with parents or healthcare workers is also a great thing for young teens to have before deciding to have sex or thinking about having sex. Each different type of birth control has a different effective rate. Intrauterine devices and systems, IUDs and IUSs, have an effective rate of 99% of preventing pregnancy. Hormone injections have an effective rate of 94%. Hormone pills have an effective rate of 91% if it is taken properly. Vaginal rings also have an effective rate of 91% for preventing pregnancy. Also, patches have a 91% effective rate. Condoms have an effective rate of 82%. Each and every type of birth control method has its own percentage and an effective rate. Each and every type of birth control has different effects. Intrauterine devices and systems do not cause weight gain or infertility, but may increase the amount of menstrual bleeding and menstrual cramps. Hormone injections can cause weight gain, irregular spotting, bleeding, or stop bleeding altogether. Reversible bone loss and delay of normal menstrual cycles once they stop. Hormone pills can cause irregular bleeding, sore breasts, nausea, or headaches. Vaginal rings have the same effects as the combination pills. Patches also have the same side effects as the combination pill. Then condoms don't have any after side effects. As you could tell at the end of this research paper, the different types of birth control and how they're effective and their causes.